Kapag sinabi natin na miss TB cases, ito yung mga hindi nahahanap na mga TB cases dahil hindi sila makapunta sa health facility dahil wala silang pera, masyado kasing malayo, or ayaw nila pumunta kasi meron pa ring stigma ng TB. Yung isa pang reason kasi kaya rin hindi natin na-diagnose yung TB kasi sa health center walang mga medtechs, walang microscopist to do the microscopy. Then yung isa pa sa records and reports may problema. Nahanap na nga yung kaso, nag-start na siya ng treatment pero kulang, no? Or na-miss ng mga health worker yung record or pag-report ng case.
The Department of Health championed the AIDERS strategy to address the needs of hard-to-reach areas across the Philippines. In partnership with the Philippine Business for Social Progress, using financial support from the Global Fund, the AIDERS strategy improves access to TB diagnostic and treatment services via capacity and systems building in health centers and communities. 385 AIDERS are deployed in 400 poor municipalities in the country, servicing about 9 million people. They are present in 32 provinces, including 273 geographically isolated and disadvantaged areas, or GIDA. In the small municipality of Javellar in Albay, 60% of TB patients are male, 15 years old and above. They are mostly laborers, engaged in highly physical and stressful work. Due to the mountainous location of Javellar, it is a challenge for residents to visit the nearest health facility on a regular basis.
Mahalaga ang AIDERS program dahil natututukan nito mismo yung National TB program. They are nurses na deployed to areas, especially dun sa mga geographically isolated and disadvantaged areas. So they are nurses that are trained, that can give counseling and health teachings and spreading the right information about TB.
The Bicol region po, since the start of the program, was given 40 nurses for the AIDERS project. During our program implementation review, we were given 10 additional slots para mag-expand ng service. So we have distributed them again to all provinces. Binigyan po namin sila ng karagdagang mga nurses.
Well, nung may AIDERS na po specifically, there was an augmentation in manpower. So meron ng mga nurses na specific na sa TB program sila magpa-function. So mas natutukan yung case finding, yung paghahanap ng pasyente, yung pagre-refer ng pasyente sa RHU, and mayroong mga staff na specifically trained for NTP na nagbibigay ng health teachings at right information sa mga pasyente, sa mga tao, spreading the news na magpa-check up at ang TB ay nagagamot sa health center.
Yung mga patient ko halos indigent. Usually mga farmers po, tapos carpenters. Every week may schedule ako para sa GIDA. Tapos kung halimbawa hindi sila nakakapunta, ako na lang minsan nagdadala ng gamot sa barangay. Ang pinaka mode of ng transportation namin is yung motorcycle. Kasi may mga part ng barangay na hindi naaabot ng jeep, motor lang yung kaya iabot or tricycle. So, may part na barangay na minumotor, tapos may part na kailangan mo maglakad. Layo is almost 3 hours, kailangan mo maglakad.
Ang akala ko noon, bali lang ito kasi nag-slide ako sa motor. Ito pala, hindi naman kaya ng hilot. Ubo ng ubo ako. Kaya naisipan kong pumunta sa center. Trabaho ko dati, junk shop. Mula nung ako nagkasakit, nagtrabaho ako. Tsaka pinahingahan man ako ng anak ko. Magpahinga daw ako. Ngayon, yun na, sa amin nila sila. Wala ko nga, mamamatay na ako . Ang sobra ng sakit ng ko, baga. Talaga granabe ako. Ngayon na man ako, natulungan ako center. Na pagbigyan nyo naman ako ng gamot na awa ng Diyos na gumaling ako.
Through the AIDERS, more TB patients in Jovellar were diagnosed and treated. From 2014 to 2015, case finding increased by 127%. 82% of these were AIDERS-contributed cases. A total of 748 additional cases were recorded. The mountainous and heavily forested terrain of Cagayan Valley makes it another area where TB case finding is difficult. From January to June 2014, there were only 807 recorded cases.
We decided, based on our experience with our PBSP hired TB aiders, that we would come up with more TB aiders which will be hired by the regional office. July, August, September, we already saw an increase of in the case detection of our PBSP aiders. We were trying to conclude that if we had more aiders, then we would be coming up with a higher case detection rate. It was group decision, the TB team, that we will come up with 20 more TB aiders which will be hired by the regional office.
Ako po si Leonardo Bacud, taga Sentro, Cabagan, Isabela. Pinanganak ako ng 1959, August 30. Kasi nagkasit ako ng una, 1990 yata. Kasi mahirap ang trabaho ko. Mamanayaw ko sa bundok. Lagi basa, tutulog ka sa lupa. Kaya nagkaroon ko nung una. Ito pangalawa, ito na rin sobra ko minsan sa bisyo. Paggamot sa akin, nung unang 2 buwan, 2 piraso po. Sa araw-araw naman may tusok ako 2 buwan. Walang day off, kahit Sabado, Linggo, masisipag yung mga nurse dito sa Cabagan. Sabi ko sa kanila, dahil masakit na sa akin dito, mag-day off naman kayo, kako. Ba? Hindi po ba? Mag-day off naman kayo para makapagpahinga yung kaway ko, kako. Masakit din eh. Dahil pa siguro sa mga nurse dito, masisipag nilang mapagamot sa akin. Yun. Kupali ako, nakarecover ako. Pinapayuhan ako kung ano ang hindi ko pwedeng gawin. Dapat hindi ko kasi minsan nahuli nila ako dyan sa kanto. Isang stick lang. Tinatago hapon. Ito po nakita nila ako, pauwi na sila hapon na. Mga alas 5. Sabi sa akin, ay sorry po ako, hindi ko alam na nakikita na pala ako. Ayun, patawarin niyo ako sa susunod, hindi ko na gagawin, ako na lang po. Salamat po sa lahat ng tumulong sa akin.
Since AIDERS deployment in Cagayan Valley, more cases have been found. The region continues to perform exceptionally well. Zamboanga del Norte is blessed with natural bounty on land and at sea. Despite this, it remains one of the poorest provinces in the Philippines. Inadequate health facilities to cater to the needs of residents, especially those in far-flung areas, is a major concern. In 2014, only 500 TB cases were recorded. The challenge lies in the lack of medical technologists in the communities.
The Region 9, with the support of our Regional Health Director, as well as our coordinators, medical technologists, and our doctors and nurses, we found out that there are several municipalities without medical technologies. As a strategy, Region 9 pioneered a remote smearing station training wherein our TB nurse aiders are trained on microscopies and on smearing. Most of our smearers are barangay health workers, and they are under the barangay captains. And some of them are microscopists, some of them are midwives and nurses. Our TB nurse aiders are the ones conducting the microscopy. So there is an ease in case finding, which is very important in our program because without case finding, you cannot detect TB. Being an aider, they're portraying the role of a microscopist. So right there and then, they could find TB patient, and with the support of the LGU, by allowing their personnel, health personnel, which is under their payroll, allowing them to train, which is the DOH who is giving the technical support and the technical side of the program. So there's a continuity in the in case finding and in case management of the TB program.
With the AIDERS now capable of doing microscopy, diagnosis became faster, and overall performance in Region 9 improved dramatically. In the municipality of Nauhan, Oriental Mindoro, up to 10% of the population come from indigenous groups or IP communities. Based on the experience of health workers, many TB patients from IP groups are lost to follow-up, left untreated. Some cases worsen to multi-drug-resistant TB or MDRT.
Yung usual naman po, meron po kaming pinakabata na more or less nasa months pa lang. Pero yung pinakamatanda po namin nasa 80 plus. Okay, pero yung usual pong mga pasyente, nagre-range po siya from 15 years old to 70 years old po yung karaniwan pong trabaho ay tricycle driver, farmer po, tsaka fisherman po yung usual. Yung buong month po kasi kinukonsume namin po pag-iikot lang ng buong barangay. Eh 70 barangays po ang Nauhan. Pumababa kami sa community at doon na namin po ginagawa yung smearing po ng phlegm. Mas maganda po kasi kung nakapag-establish ka ng rapport dun sa community, mas madali mo silang mahikayat na magbigay ng sample ng kanilang phlegm para mas ma-detect yung kung anong meron man sila.
Ang aking nararamdaman, pag ako galing sa trabaho, mga 2 araw, ako ay sa bahay, ubo ng ubo. Ikaw ko na ko, may pit na itong ubong ito. Hindi na makuha-kuha. Yan, mayroon dumating na yung kuwan nga, pagkuha na ng plema. Doon na kami sumama. Malay mo kung anong sakit. Nagpakuha pa kami ng plema. Di, nung kuwan na, sabi ay may dumating ng kuwan. Resulta na kami raw nga ay meron. Nakapagtataka naman, parang malakas pa rin ang aming katawan. Pero mayroon na pala sa katawan kung anong nararamdaman. Di, tuloy na ang aming magpan ng gamot para maagapan. Mayroon naman siya nang isip, wag na, matanda na. Pero wag pa rin. Wag, kawawang mga anak, mga apo. Tayo pakinabangan pa rin tayo. Para tayo ay lahat-lahat na tayong magpagamot para iwasan natin ang sakit na yan. Kaya kami sabay-sabay na rin.
Ang kampo namin, doktor ang nakakaalam.
Ang doktor ang nakakaalam. Kaya kami lumapit. Ay, sinami naman namin sa doktor, wala kaming pambili ng gamot. Ay, libre na kayo. Libre kayo ng gamot. Salamat naman. Ang aking apo, nagkaroon ng TB sa buto noon. Bago yung iba naman, kasabay din mga 3 tao. Tinatapon na kanilang gamot. Tinatapon. Naingi naman sa akin nga po, bago sabi ng akin, wala, hindi, ito naman na bilang ng araw. Talagang tutuparin ko ang gamot na ito galing sa doktor. Di tinupad nga, tuloy-tuloy ang pag-inom. Bakit hanggang ngayon? Lumalakas at mataba ang uminom na yan, malakas na uli. Ay yung isa, 2, patay na. Siyang karanasan ko yun. Kung hindi galing sa doktor, kung hindi tinupad, talagang mamamatay ang abot.
AIDERS in Nauhan contributed 45.83% of the total TB cases recorded in Oriental Mindoro. Overall performance of Region 4B has also improved by 12%. Through the partnership forged by the DOH, PBSP, and Global Fund, TB case finding in the areas with AIDERS improved by almost 16%. But the fight against TB doesn't stop here.
The experiences shared by the patients and the health workers have shown that the AIDERS have contributed a lot in finding the missed TB cases, and this resulted in the increased case detection rate. So patients were also satisfied with the care provided by the AIDERS. Sabi nga ni Tatang, sana merong day off, but we cannot afford to have a day off since this would also mean a day off for our TB bacilli, and they will have a chance to multiply and to infect other people. So the AIDERS have shown that we need to go to the communities to look and to reach out to our patients to find and cure them, and this is the way to eliminate TB. To sustain these gains, we call on our local government units, other partners in the private sector, business sectors, to support the AIDERS and to invest in the AIDERS initiative. So let us all join our forces to eliminate TB. TB ay tuldukan.
Together we can stop TB. TB ay tuldukan.